It wasn't easy yesterday.
A power outage, a pipe leak. These are just some of the latest incidents that have affected patients and staff here at Montreal's Maisonneuve-Rosemont hospital in recent days. The aging hospital has been in a dilapidated state and was thrust in the spotlight over the last few months after reports of power outages, rodents, and other issues in the facility that prompted the province to release the funds for the long-anticipated renovation project.
There's an urgent need to reconstruct the hospital and also have measures to ensure that we can treat patients well for the next 10 years at the time the hospital is rebuilt.
It started with a pipe leak on Sunday. Videos were taken of the water coming through the coronary care unit and the aftermath of it.
The patient had to be moved from the coronary care unit, where you have patients with significant heart issues like critical conditions. They had to be moved to the medical intensive care unit because of the water leak. You understand there was water coming out from the ceiling. Parts of the ceilings fell off. It was very sleepy on the floor. It's not working conditions for the staff.
Then the power was out in the neighborhood Monday because it was shut down by the fire department. The CIUS de l'Est de l'île de Montréal says backup generators took over to power critical activities, unlike when a storm in late April led to a power outage, leaving several critical units in the dark and delaying more than a dozen emergency surgeries.
In the outpatient clinic, a lot of office, the computers went out and there was no lighting. Some surgeries were delayed as well because they didn't want to start elective surgeries on backup generators. So it did have an impact on patient care, but the critical parts of the hospital were not affected as last time.
But it meant a slowdown in certain hospital activities affecting patients like Linda Duhem. I'm doing treatments and was in a waiting room that had to relocate. I waited at least 2 to 3 hours to get my appointment. When you're being treated for cancer, you're hoping to get out of there quickly. Faced with increased pressure, last month the Quebec government responded by releasing the necessary funds to finance the renovation project in its entirety, with the first phase of the project, the multi-level parking structure, costing around $90 million. City News reached out to Santé Quebec for a comment, but they didn't get back to us in time for our deadline.
It's going to be a challenge to keep treating patients in the old tower for the next 10 years. So we hope that the maximum is done to try to accelerate the project and also make sure that we keep the hospital safe and functional for the next 10 years.
In Montreal, Alyssia Rubertucci, City News.